Hello, my name is Gary Rosinski. I'm the co-leader of the Boston chapter of Citizens Climate Lobby, and this is our monthly meeting for the month of June. Tonight, we have a special guest to talk with us about the similarities between the COVID crisis and the climate crisis. His name is Dr. David Cash, and he's currently the Dean at the McCormick Graduate School of Policy and Global Studies at the University of Massachusetts, Boston. Prior to this, he held senior positions at the Massachusetts Department of Environmental Protection, the Department of Public Utilities, and Executive Office of Energy and Environmental Affairs. In these roles, he helped develop and implement nation-leading science-based environmental, climate, clean energy, water, and waste management regulatory programs, innovative renewable energy and grid modernization efforts, and the Regional Greenhouse Gas Initiative, the nation's first CO2 cap and trade program. As I said, Dr. Cash is here this evening to give us his perspectives on the similarities of how the COVID crisis and the climate crisis are both evolving. And with that, I'll hand it over to Professor Cash. Thank you, Mr. Cash. The floor is yours.
Well, great. Well, thank you very much, Gary, and thanks for reaching out to me. And I really love having these kinds of conversations. I'm going to talk about something a little bit different than directly on the Massachusetts clean energy landscape, because I think the events of the last several months kind of put climate policy and climate investments in a different light that I'd like to talk about. And hopefully we'll have some time to dig into other questions that you might have about Massachusetts. As Gary noted, I was in state government for 10 years and worked on a whole range of environmental and energy issues and climate issues in various different positions. I appreciate the role that you folks play, especially with your priority of pricing carbon, and certainly the Regional Greenhouse Gas Initiative was our attempt to do that using a cap and trade mechanism, and happy to talk about some of that too. But with that, why don't I just, usually I spend some time getting to know my audience a little bit better, which of course is easier in person, though actually not that hard on Zoom, I've discovered. But I also figure I have limited time, 20 minutes. I figure I'll go through this, and anybody is welcome to get in touch with me. Gary has my contact information, and I'm pretty easy to get in touch with, so anybody's welcome to contact me. So let me share the screen now. I've been thinking a lot about the intersection, not necessarily the intersection of COVID and climate. I'm not as interested in things like our emissions reductions because of the economic downturn and things like that, but I am really interested, having been a policy wonk, a professional policy wonk, and now being the dean of a policy school, I'm really interested in the lessons learned from what's been happening over the last couple of months and what they can tell us about moving forward. So let me jump into this. In many, many ways, we know that COVID-19 and climate change are not similar. I mean, one is a pandemic, one is a self-induced environmental calamity that intersects every part of the way that we run our lives. So we can think of them as very differently, but as someone who's very interested in solving the problem of these kinds of big trans-border kinds of problems, I look at how they are similar, and then I'm going to look at something about how our responses to them from a policy and a communications matter has been really similar and has been really problematic in both cases. So first of all, both are lags in a nonlinear system, right? You know, there was so much discussion in March and April about the curve, flattening the curve. And we were on this curve, this exponential curve, because there's a lag in infection turning into full-blown disease and death. And there was also a lot of asymptomatic transmission that we had no idea was happening. And so, you know, in early March, when the numbers started coming out and there was an exponential nature to it, you could really see, or you could predict, that if we don't do something now being what was then late February, early March, then later actions are going to be much more difficult. That was the whole point of flattening the curve. because the curve needed to be flattened because of capacity constraints, for example, in the healthcare system. If the curve was too high, we wouldn't have enough ventilators. We wouldn't have enough ability to test, et cetera. And so if we take later action, if we wait, then the negative impacts are going to be much greater than otherwise would be. And the costs are going to be much greater. And we see the same exact thing in the climate regime, right? That if we don't act now, if we didn't act in the 80s and the 90s and the 2000s, first of all, mitigating now becomes much more expensive, and the impacts are much larger. The impacts of hurricanes and wildfires, the impacts to agricultural systems are much greater if we act later, and we have acted later. And so we see that in both systems. And I'll highlight some of the policy implications there. Both of these are efforts to balance the health of people or planet and the economy, where there's often stark trade-offs. Sometimes there are not stark trade-offs. Sometimes responding to protect health or protect the planet, protect health of people or the planet actually has economic benefits. But for many, I mean, there's no question that the choice to shut down our society essentially had major economic impacts, but we know the benefit of that was to protect health. Both are exhibit, again, very stark equity problems where the most vulnerable populations are hit hardest by both of these diseases, but by the disease and by climate change. And again, there are lots of drivers to that: pre-existing lack of opportunities, pre-existing poor health, pre-existing inability to afford insurance, to rebuild, to be resistant, et cetera, et cetera. Many, we could go through all of these. By the way, I know that folks are chatting, and I'm probably, if you have, oh, I see, put questions, Dr. Cash, in the chat, and then you will get them to me. Okay, that's great. Both are have some degree of externalities, right? Of the companies that produce fossil fuels, people that use fossil fuels don't pay for what those impacts are. They pay for the fuel costs. They pay for labor that produce that. They pay for the hardware to get the fuel to you. All of those things, but none of us pay, except in a few situations around the world, none of us pay for the impacts the production and utilization of fossil fuels makes. And we saw this to some degree in the early parts, and I'm sure we're seeing this right now. And I'll talk about this a little bit more about how the externalities of if you are not worried about your health, and so you don't wear a mask or you don't social distance, you're not paying for the externality of the impact on other people. And then both of these have really clear global through local dynamics. We could, again, I'll talk about this a little bit later, but both the course of the issue and the policy responses have local, state, federal, global dimensions to them. Okay, so here's how I'm going to kind of walk through this, if I can get these. Okay, and I'm going to argue that for both, the policy failures is that we've been too slow to respond and that we've taken inadequate action on both of these cases in sometimes very similar ways. So here, as of mid-April, these were the COVID-19 deaths in the United States. So again, if we're talking about the impacts that are nonlinear, what we're seeing here is your typical nonlinear curve, where it's relatively flat throughout February and March, and then it starts this upswing. Of course, we've seen it level off to some degree in some places, but here's when we think about the ways that I said they were similar, there are, hold on if I could move things out of the way here. There are like 7 major ways that too slow and inadequate action happened. I'm going to talk specifically about 5 of them, but in both cases, we saw marginalization of scientific advice. We saw an effort to diminish how the public perceived the risk and therefore actually how the public perceived risk. We failed to take a variety of different kinds of investments. So whether this was investments in developing new clean energy technologies early, or production, making sure that we were investing in supply chains for PPE and things like that. As I noted, there are cases where externalities were not internalized. I'll give all the ones that are bolded, I'm going to give examples of. One of the things that both cases show too is that we discount the nonlinear nature of the system. It's really hard for humans to really grasp what exponential change is or what tipping points are. And so we discount those. I'm not going to talk about it in detail, but in both cases, we're seeing poor federal, state, municipal coordination, and you can add global to that as well. And then in both, we've ignored the equity dimensions. So I'm going to go through examples. This is a non-quantified way. These are anecdotes that I'm giving. This is too early in COVID to have done really good research on this at this point, but I think they're going to illustrate the point. So, okay. So number one, marginalization of scientific advice. The Trump administration disbanded the Global Health Security and Biodefense Unit of the National Research. This was it wasn't the NRC. It was the security department within the White House. So that was, what's that?
NSC.
NSC, thank you. Yeah, typo there. Sorry about that. National Security Council. And that was disbanded in 2018. It was the essential body that would incorporate scientific advice into the decision-making that would happen. Many quotes that Trump made that diminished the public perception of risk in January and February. This is just one of them. It will all work out well, but there were many that could be documented, and he wasn't the only one. There were many public servants who were doing the same thing. As I mentioned with test kits and PPE, first we decided not to use WHO test kits. Now there's a lot of debate why and why not, and there's historical reasons why we have in some cases not used WHO test kits, but not in a case that was evolving as rapidly as it was now. And there was inadequate development and rollout of such kits. So limited upfront investment of actions that could have mitigated the longer term risks. So the one example of externalities is all of the news that we saw during spring break, when we had many of these young people going to parties in Florida. And they, of course, were not internalizing the external costs that they would have to either the other partygoers or to anyone that those other partygoers bumped into when they returned back to their homes, including their ailing parents and grandparents and things like that. So there was no, those externalities were not internalized. And then really interesting case, I followed it in Massachusetts, but it happened everywhere, where the ventilator guidelines that first came out in Massachusetts when we thought that there was going to be inadequate ventilator resources were prioritizing younger people and people without pre-existing health problems, particularly lung or other pulmonary kinds of problems. And of course, when you are living in a city like Boston, which has very well documented environmental justice communities where citing of bus depots and prior to this, dirty burning petroleum oil plants and things like that, that already, and in communities where Black and brown and low income children have much higher rates of asthma, for example. Of course, those guidelines are not going to favor those already disproportionately vulnerable communities, and so bake into it the structural racism that we already are experiencing. Okay, that's COVID-19, and I'm going to show you a really similar kind of graph for climate change. The impact in COVID-19 was death. The impact I'm looking at here is global temperature. You can look at other kinds of impacts that have had similar kinds of curves. Some of them are even more nonlinear, particularly when you take things with tipping points. So there's a good argument to be made that sea level rise is going to happen. There's going to be a gradual nature of it as temperature increases, but you're also going to see when there's extreme, like when the West Antarctic ice sheet melts rapidly, you're going to see big jumps, big nonlinear jumps. And notice the time scale. So I was looking at this from January to April in my COVID graph, and this is 100 years, 100 plus years of examination, or actually more than that, 200 years. But I'm really interested, it was 3 months of decision-making, January, February, and March, in which all of those mistakes that I outlined happened. for us, we could look at the 3 decades, from the 1990s, 1980s, 1990s, and early 2000s. And we're going to see the same, this is the same list of the categorization of too slow and inadequate action. And I'm just going to put, similar but different, somewhat out of order, because the chronology was different. So I posted them chronologically, but not in the numbers of the examples. So one of the limiting upfront investments, there are many, many ways that the United States has limited upfront investments. One is the uncertainty in the renewable energy production tax credit. So from 1992 on, it's had to get re-upped by Congress every year or every couple of years. And that just gives huge uncertainty in the private sector in terms of how they're going to make investments for renewable energy. And so, of course, they don't invest in renewable energy as much as they would if there weren't that uncertainty. So that's the number 3. Number 7, again, Katrina is only one of the stories of both response and the impacts, but the responses to Hurricane Katrina, again, very well documented how the responses favored well-off and white communities and hurt low-income and Black communities in New Orleans. And we see that time and time again with all the hurricanes that have hit. Number 4, internalizing the externalities. Our one big gamut at this recently was in 2009 with the Waxman-Markey bill, which was working on a cap and trade program that would have internalized the externalities, and that failed. Diminishment of the public perception of risk. Again, I'm picking on Trump here because he's our current president, but the first time that he called climate change a hoax was in 2013. But there's, again, a long, long history in the disparagement of the scientific, to diminish what the risk might be of climate change to communities, to people, to the economy. And again, there's a long, long history of marginalization of scientific advice, not just from government, but from the fossil fuel industry. That's been very well documented. But we've seen cutting the role of science and EPA and the U.S. Global Change Research Program in this administration that's marginalized the scientific research that could influence decision making. And so that's it. So these are all areas. And again, I didn't go through 5 and 6 at this point, and I have not yet written up this. This is something I'm looking forward to writing up soon, because I think what this speaks, particularly at this moment, when we're not just dealing with climate change, but we're dealing with the pandemic. We're dealing with the impact of the George Floyd murder and the way that has really brought to the fore, better than it ever has in the past, the underlying racism in our country that drives a lot of these kinds of impacts that we're seeing. We're at a moment where we could be making a difference. And the one thing I'm going to say in the vision forward is, and many people are talking about this now, as it seems like there needs to be more stimulus funding coming from the federal government. In my mind, there's no question that a huge chunk of that could be going to transforming the energy system. It was we experienced that in 2008 and 2009 to great effect. It increased jobs, it advanced the clean energy sector, it reduced greenhouse gas emissions. That's something that we're poised to be able to do right now. And in my mind would have all of the, and if done wisely in terms of both of assuring that the benefits of such a program adhere to those who have been marginalized in the past. So you can imagine huge programs of energy efficiency, workforce development that are targeted to low-income communities, communities of color, et cetera. So that's what I think is the big push that a lot of, that a lot of the failures that we've seen could be addressed, certainly on the climate side, as we move forward. Why don't I stop there and then happy to take questions.
Okay, thank you. I'll just start off with one question, which is, do you have any insight into how much appetite there is on the part of elected officials to be talking about topics other than COVID right at this point?
Well, I actually think it's COVID has been displaced by dealing with police abuses and racism right now. It's been pretty remarkable how COVID has not been as in the news as it's been. So my guess is, you know, as we are a culture of fast social media, both of those topics are eventually going to come off front pages. And I do think across the aisles, there are lawmakers that are looking how to address multiple issues at the same time. And, you know, so at this moment, no, I don't think there is. In fact, I drafted an op-ed that encapsulates what I said at the end about in terms of a stimulus package that focuses on clean energy. And I submitted it to papers right before the Minneapolis police, and you know, I'm assuming it's sitting somewhere and it's not going to be looked at because it's just not timely right now, and it's and reasonably so. Shouldn't be. There are more important things at the moment.
Okay, so we have time for one or two other questions if people want to pop them into the chat. But there's a question there from JTK. How do you sell the change needed to mitigate climate change to the general population when we were unable to do so for COVID, where the impacts were much more visible and immediate?
Oh, that is a really good question, but I think the fundamental answer, and I'm going to answer it based on the experience in the Patrick administration. So we drove really hard a clean energy agenda, climate agenda, and it vaunted Massachusetts up to #1 in energy efficiency. We've been there for 9 years, et cetera, et cetera, et cetera. We always framed it as an economic issue. We always framed it as an issue that related to lowering your or a business's energy bills, that had to do with job growth, that had to do with energy cost independence, that lowered the energy volatility of energy bills, all of those kinds of things. And yes, big environmental issue, biggest moral issue of our time, but we led with the economic dimension of it. Because at the end of the day, there's a ceiling at which I think environmentalism in its more traditional form is embraced by people. And people are gonna focus more on pocketbook issues. And so I think it's really critical to frame it in that kind of way. And I've always thought, for example, like we will have won the electric car, fossil fuel car debate when the car lining up outside of the Dunkin' Donuts drive-through are electric vehicles. It doesn't really matter that there are a lot of electric vehicles in the Whole Foods parking lots. That doesn't matter. What will matter is when those are the cars that are parked at Walmart and Dunkin' and those kind of places, because that will mean that working class families are going to make the choice to get electric vehicles because they're smarter and cheaper and better.
Okay, great. Well, we don't seem to have any other questions. So thank you very much for spending some time with us this evening.
Absolutely. Thank you very much. And again, anybody's welcome to reach out to me if you have questions, et cetera.
All right, thank you.